The idea that one does not know that they have hearing loss is a common one. My name is Dr. David Godin, and I'm an otolaryngologist, head and neck surgeon at ENTA and Allergy Associates. Glenn Go has been a patient of mine for approximately 10 years now, and Glenn has a congenital hearing loss diagnosis.
The call to action that I had was when I first moved here for college. Here I always found myself trying to accommodate the situation, like sit in the front of the classroom, ask people to repeat themselves, take notes, and prefer emails over being in conversations and groups. And it wasn't until a lot of people just told me to my face, you need to check your hearing. You need to get your hearing checked. And so I did that, and that's when they told me that I have the hearing loss of someone who is in their 60s.
Most primary care doctors do not screen for hearing loss. Approximately 14% of primary care doctors actually screen for hearing loss, and that's because of some lack of training or lack of equipment or what have you. But these people leave the primary care office and never know that they have hearing loss, just like Glenn went many years never knowing that he had hearing loss.
A while ago, all hearing aids were doing was picking up everything and making it louder. Nowadays, it kind of figures out the situation you're in and acting accordingly. So how it's acting in a room like this is one way, versus when Glenn goes into a bar or restaurant, it's going to act completely differently to really help him hear best in those situations.
The moment I got hearing aids was when I started to really see the comparison with having hearing aids and hearing and experiencing things that I took for granted or just thought never existed before. I could hear soda fizzing, keys in the lock, the air conditioner buzzing, and I actually participated in conversations more. I was more in the moment instead of having a dialogue with myself and trying to, I would say, blame other people, like they're not talking loud enough or I don't need to be a part of this conversation, but I was more present.
So this is the style of hearing aid that Glenn has. It's called the receiver in the ear hearing aid. All the components are behind the ear. It allows lots of components being there with 2 microphones and a lot of technology. Basically a whole computer is sitting right over here and delivering the sound right over here into his ear. Because of this style, this all hides behind the ear where you really can't see it, and this thin wire really disappears.
Hearing aids certainly provide an increase in the quality of your life. And I think one of the things you alluded to is a very important fallacy that's out there, that you have a 60-year-old's hearing. Because there's no such thing as Dr. Lerner attested to. Data shows that 1 in every 5 adults or people over the age of 12 have some degree of hearing loss in 1 or both ears. That's around 48 million people in the United States have hearing loss. And unfortunately, 30% or less use hearing amplification devices like Glenn's hearing aids.